The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc. I am Dr. Rednam. I am a board-certified plastic surgeon in Houston, Texas with my Houston surgeons. Today, I want to do one of our little shorter chats. I want to talk about pain control. You know, pain control is a very difficult topic for some people, and it's because pain is generally a very subjective feeling. I truly believe that pain starts up in our minds. Yes, our bodies sense pain, but how we handle that pain really starts with how we think. That's why it's so important when you're considering surgery, whether it's plastic surgery or other surgery, is to really spend some time thinking about how it is you deal with physical pain. I put a big emphasis on mental health. A lot of people think, well, what does mental health have to do with pain? But when you are in a good place mentally, you are better prepared to deal with your physical discomfort. When I'm approaching pain, I'm going to approach it from multiple angles. So like I said, I'm going to first make sure that we're approaching it mentally, that you're ready there to handle that. Because when we have a lot of emotional pain, it can manifest as increased physical pain, which is very common. And I definitely see that because we can't screen out for everything. We can't capture everything. But knowing that ahead of time and being prepared, you know what, I am dealing with a lot of things. Sometimes that's a good time to say maybe surgery isn't definitely right for me at this moment. Other things that can definitely affect pain are just our general medical health and conditions. People who exercise a lot, people who are really active and up and about are generally going to do better from a pain standpoint after surgery than people who sit around a lot. Why is that? When we're really active, especially if we're athletic, we are pushing our bodies. So your body gets used to certain amounts of discomfort and maybe not be direct pain, though if you've ever run a marathon, you know there is direct pain there. It is really about pushing yourself. So if you've learned to push yourself to a little bit each time, then your body is pushed in surgery and it can handle it a little bit better. Other things that can affect how we handle pain are if we have certain medical conditions. So there are certain conditions like something called fibromyalgia, where people sense and feel pain on a different level than others do. If you're a person that has this, you may even have to take certain medications to be able to handle just the everyday stimuli that we get in our bodies. So if you're someone like that, then you may feel average pain in a much heavier sensation. You may feel it much more than somebody who doesn't necessarily have that specific disease or condition. So that's why, again, understanding your general health before you have any sort of elective procedures is really important. Other ways that you can minimize pain after surgery, and if you've noticed, I haven't talked at all about pain medications yet, is having good support. When you have a lot of support and a lot of positivity around you, you just do better. And yes, someone can say that sounds hippy-dippy, sure, but I'm being honest and truthful. When we are surrounded by positivity, when you have positive thoughts in your head, you have positive people around you, it really physically gives your body a better environment to heal in. You have less stress, you have less steroids running around in your body, and you absolutely can feel better and heal better. So let's talk now. We've kind of talked about okay, what are things from our body that we need to approach our mind? Let's talk now about pain medication. In the past, it was very easy just to say, here's your narcotic prescription and good luck. But the problem is that narcotics don't actually treat pain, they mask pain. So think of it as you're just putting a Band-Aid over something, but you're not healing it. And there's certainly a place for it. I definitely do use narcotics in my practice for appropriate procedures because there are times where you do just need that little extra help from that pain, from the pain that you're experiencing. But we know from a lot of different studies and something specifically called the ARIS protocol that there's multimodality ways for us to improve pain. Some Some of that is even medications and treatments as simple as Tylenol before we have surgery. Other things that can help a lot with augmenting the effects of some of the pain medications you use are sometimes using things like muscle relaxers. Muscle relaxers can help relax our body, relax how we feel, and can augment the effects that we see with some of the narcotic pain medications. But there are negative side effects, especially to narcotics. We can see constipation, slowing your bowels down. For some people, they can get extreme gas issues and bloating. And for a lot of people, it gives them a fog, right? They don't really know where they're at. There's more chances of them falling, injuring themselves. So what are some of the other things that we can add? And things like NSAIDs, so non-steroidal anti-inflammatory medications. Common one that everyone will know is ibuprofen, right? A lot of times we don't like to start this right after surgery because it can thin your blood. We don't increase the chances of bruising. But generally about 48 hours afterwards, if you are someone that can have this medication, we like to incorporate it. I say can because many patients who've had gastric bypasses or sleeves may not be good candidates for these medications because it puts them for higher risk for having problems with the lining of their stomach where they had the surgery. So those are all things that you have to kind of keep in mind. But believe it or not, Tylenol is a great medication. Maybe it's not going to cover everything, but it's something that we can help to augment. There's also medications that work just on your nerves. So an example is something called gabapentin. It's used for a lot of different things from diabetic nerve pain to just general anxiety even sometimes, as well as pain after surgery. So I find that it helps a lot of my patients, and I have them take it before surgery, and not all of them, but some of them after surgery, to turn the volume down when it comes to the discomfort that you may be associating with the nerves waking up after surgery. I also really like to use local injections. Everybody is familiar with lidocaine. That's usually what you get at the dentist. That helps numb things. But those type of medications are short acting. They don't last very long. There are other medications like something called bupivacaine or Marcaine that can last 6 to 8 hours. Well, what was developed within the last several years is something called Exparel. Now, there may be other brands now, but basically what Exparel is it's a long-acting Marcaine. It's coated basically in proteins and slowly time releases from your body. If I take this and I can target the nerves, let's say you have a chest or breast surgery, I can target the nerves that go to that area of your body. It slowly time releases over 3 days or 72 hours. So the best way I explain to patients, I can turn that volume down and I can make it so that your brain says, I'm doing good with the pain medication, or sometimes not even requiring much of any. You can get up and you can move. And by the time it wears off, you've already been up and moving. You've tricked your brain into thinking you're doing pretty good. And it doesn't mean you may not need any other pain medication, but now you're up and you're moving. You lower your risk for blood clots because you're moving. And again, you've just told your brain, I'm doing good. And so you're just much more apt to get up and move and recover faster. So there are so many things we can do. Even lymphatic massage can be helpful. While it can be tender initially when you do it, if we find ways to reduce your swelling, which lymphatic massage helps a lot with specific procedures, then you're going to have less pain afterwards. So all of these things coupled together can do a lot better than me just giving you a lot of pain pills. And I know that a lot of people will say, well, the opioid crisis really ruined it for those of us who really, really need this. So it is still there. It's still part of my post-op protocol. But I feel that the best surgeons out there are looking into all of these different things to help you have a multifaceted approach to really helping with your pain control afterwards. Everybody, again, I said, subjectively experiences pain differently. So it doesn't mean that there's no pain. I personally had plastic surgery and experienced pain with it, but the goal is to make it tolerable. And I know no one ever likes me hearing saying this, but nobody has ever died of pain, but people have certainly died of too much pain medication. And as your surgeon, we always want to make sure we're taking care of you the best way we can. And that also means that we adjust things as we go. So if you are interested in surgery, you're talking with your surgeon wherever you're at, make sure to ask these questions and find out what their plan is for you rather than just pain medication. What's everything that's going to be out there to help you recover and do the best you can? So I hope you learned a little bit on this short version of my podcast, but just remember, plastic surgery may not be pain-free, but it can be a more comfortable and pleasant recovery if you're well prepared for it. So thank you for joining me on this episode of the Confidence Doc Podcast.